somewhere in this city tonight is a middle-aged woman with her story. I met her a couple of years ago on a cold December day in our healthcare clinic. And her problem was that she had this obsession. And the obsession got her into a lot of trouble. And when I met her, she was a broken woman. And what was that obsession? Well, she was born in Afghanistan, and her obsession was that she was obsessed about teaching women how to read. And for that, she was attacked not once, but twice by the Taliban. She decided with her husband to leave the city they were in and move to the other side of the country. But after a while, they found her there also. And one day they went looking for her husband, and when he wasn't there, they shot his co-worker. And they knew it was time to leave. That very same day, they put together whatever they could, and they got on a bus, and they crossed over the border to Pakistan, into a town called Peshawar. And they languished in Peshawar until they found someone they could pay to bring them to Canada. And a few weeks later, they arrived at Pearson Airport on a very cold December night. And the person who brought them there gave them an address and disappeared. They got into a taxi, and they went to this address, which turned out to be a government building. And needless to say, at 10 o'clock on a Friday night in December, the government building was closed. So there they stood in front of this closed government building on a very cold Friday night, 6 weeks removed from everything they knew, not being able to speak English. And they did the only thing they thought they could do. They looked around the taxi driver, curious where all this was, still waiting. And they got back in the taxi and they went back to the airport. And they sat there because they couldn't speak English. And finally someone recognized them and were able to get them to a refugee shelter where we had a small clinic where we saw her and her husband. Now they came at the wrong time, because if they had come 10 years ago, I think we would have been able to help them. We would have had health insurance, we would have helped them with settlement. And although people did as much as they could, she had absolutely no health insurance. No health insurance to deal with her trauma, no health insurance to keep her healthy, no health insurance for counseling, which she obviously needed. But that's not necessarily Canada's legacy, I would argue. And some of you are probably as old as me and might remember this event in the not-so-remote past. It was in the late 1980s where there were incursions by China into the north of Vietnam. And in response, the Vietnamese government decided to expel all ethnic Chinese. In the confusion that ensued, many people took the opportunity to leave the country. And although most left overland, the issue really came to the attention of the West, and we saw pictures like this. Overcrowded boats of mostly Vietnamese refugees in shark-infested, pirate-infested waters of the South China Sea. Now, in Canada, the government at that time, which was a conservative government, I should add, put out a call to Canadian citizens, and they said, you know what, for every one person that's privately sponsored, the government will match that. Well, 40,000 people were privately sponsored to come to Canada in those 2 years. And the government looked at that number, backed up and said, we'll take 10,000, and we're eventually changed to taking 20. So 60,000, mostly Vietnamese refugees, ended up coming to Canada in the 1980s. And I think it's a very important migration. It's a very important migration for two reasons. One is, you probably all remember 5 or 6 years ago, this boat arriving off the coast of British Columbia. This time not filled with Vietnamese, but filled with Sri Lankan migrants. And the response from the Canadian government now is very different than what happened 35 years ago. There were apparently high-level talks about intercepting this boat in international waters and sending it back out to sea. The second thing about that migration, which I think is really important, is that to this date, I think it's the best studied of all refugee migrations to Canada. And this is really through the work of Dr. Morley Beiser, who was here in Toronto now, was in British Columbia at that time. And he was able to follow 1,500 mostly Vietnamese refugees for over 10 years. And what did he find? Well, interestingly, he found if you follow people long enough, their rates of employment were actually higher than people who were Canadian born. More of them were working. And interestingly, the rates of mental health issues were lower than people who were Canadian born. Now, that's a bit of an outlier. But as I think many of us know, people do well if you give them enough time. But they certainly need support upon arrival. So where are we at in terms of global refugee migration? You know, I've done a similar talk for quite a while, and I've got to say the terrain has really changed in the last 2 months. But these are numbers that I think most of you are probably aware of. We have, in 2014, close to 20 million refugees in the world and over 40 million internally displaced people. These are the highest numbers since the Second World War. What's interesting is that although we hear about the refugee crisis with this massive movement of mostly Syrian refugees in Europe, the vast majority of refugees end up in the developing world. In 2014, that was 86% of refugees are in the developing world. And we know that in 2014, there were over 1.6 million refugee claimants. And that number, of course, is going to be much higher. And we've all seen these pictures on the news recently. Where are refugees going to? So over the last 9 or 10 years, we've had this notion that we're being overwhelmed in Canada by refugees and refugee claimants. We've had similar expressions by some politicians in the US. But when you take a look at numbers, most refugee-receiving countries are relatively poor countries. They are in the developing world. So Pakistan has been number one on that list for a long, long time. Lebanon now, with the Syrian migration there. Iran, Turkey, Jordan, Ethiopia, Kenya, Chad, Uganda, and China. So we don't see a Western industrialized country in the top 10 on that list, despite now the screams about the refugee crisis. This refugee crisis has been going on for a while in many countries in the world. When we look at these numbers, now this is in 2013, I was going to update this slide, but I think there was a message in this. When we look at refugee claimants and the movement of refugee claimants, you'll see in 2013 that there was an increase of 28% from the year before. Okay? That number has skyrocketed in 2014, and it will certainly be the highest that it has been a long time in 2015. But where are they going to when we look at Western industrialized countries? Well, you see Europe saw a 32% increase, the Nordic countries were up, Australia, which has gone to a lot of trouble to deter people from actually arriving there, saw a 54% increase. Even Japan, there's very few refugee claimants going to Japan. Korea, the US saw an increase, France, and in Canada, we saw a 50% decrease in refugee claimants. And just to look at that graphically, since numbers have been kept in 1989, it was the lowest recorded number. Now, we can all hypothesize why, but I think for many of us who work with refugees, the simple answer to this is Canada has become a less welcoming place for refugees and refugee claimants. I think through a number of policy changes and through a tremendous amount of rhetoric, the government had been very effective in actually deterring people from coming here. When we look at the rich history of Canada reaching out to people fleeing persecution, I think this is something that should be of concern to us. Now, to be fair, that number was up in 2014 to about 13,000, but well below the 20 to 30,000 we usually see. And interestingly, until last year, the acceptance rate was also very low. So not only were we seeing less people, but the ones we were actually seeing had lower acceptance rates. Okay? So the terrain is changing, right? Or the terrain has changed. I want to share with you a case from the refugee shelter where I work. And this was a case that highlights some of the issues that we work with, although I would argue that it's a fairly unique migration. But these are stories I think many of you have heard through the work that you do. This was a 39-year-old woman who arrived from North Korea. Has anyone met anyone from North Korea? I know you have this here. I never had until about 2010, 11, we started to see a trickle of Christy. When she told me she spent 3 years in China, she knew herself she had hepatitis B. And she had some type of kidney problem, which she attributed to working in the mine. I have no idea what that was. She complained of swelling of her legs, and she carried 5 different pills in a Kleenex that she brought with me. I have no idea what they were. We actually ran down to the pharmacy and we couldn't identify what they were. But she was on medication. She had been seen. She said some kind of kidney problem. I think this is a medical slide. We examined her. There were a few things to find on exam. And I remember where I was when I got the lab results the next day, because the lab called me. And her kidney function was so bad that I got in my car, I went to pick her up, and I dropped her off at Toronto Western Hospital. And they were fantastic with her. That was on a Tuesday or Wednesday evening. It was on a Tuesday, actually, because they set her up for dialysis almost immediately. And she started dialysis on a Wednesday, and she went back on the Friday for dialysis. And then she came back to the shelter, and she was quite upset. And the shelter workers were absolutely fantastic, sat with her, and they tried to figure out what had happened. It turned out she had some conflict with the nurse. And she just told me, we'll help mediate this, but you have to go back. I don't want to go back. So, like kidney failure. We'll deal with this, we'll speak to the nurse, we'll find a way to figure out what happened. And she politely said thank you, and she went back to her room, and they never heard from her again. She absolutely disappeared. They went to speak to the roommate, who was also North Korean, and we were told she went back to North Korea, which is of course ridiculous. And to this day, which is probably 3 or 4 years later, we Did she leave the country? Did she go to another city? Did she end up in another hospital? Did she die? We got a call a few months later from public health to track down her hepatitis B. She indeed did have hepatitis B, but that was it. Otherwise, in our world, she completely disappeared. Now, I had never worked with North Korean patients in a big way, so I went to the medical literature to really try to get a sense of what do we know, what should we be thinking about? Is renal failure common? What are the issues in the North Korean population? And interestingly, I found very little. There were some studies that came out of South Korea, where the majority of North Korean refugees end up. And we know that there were people who were malnourished, there were some parasites in some areas, but really nothing that gave me a sense of the texture of that migration. How did people look at healthcare? What are the issues? So I went to the lay literature and I ran into this book. Has anyone seen this? It's a fantastic story. This is a story about Shin Dong-yuk. And Shin Dong-yuk is the only guy that we know of who was born in North Korea's notorious political prison camps, who'd actually managed to escape. He writes very eloquently about the famine in the camps. He, in his own words, said he's learning to be human because he was never expressed any love in his life. He had absolutely no remorse when he saw his mother publicly executed in front of him after he turned her in for talking about escaping. He talks about sifting through the droppings, the poop of cows, and looking for undigested corn and wheat to keep him alive. And when he finally did escape, and he had to cross a barbed wire fence, and a colleague of his, a friend that he had made in the camp, was electrocuted, and he climbed over the body. But he said his motivation was not freedom or to stop being beaten, but this friend who had been on the outside had told him there's people on the outside world who have full bowls of rice. And that was the image he had as he actually crossed that barbed wire fence. It's an incredible story. And so we started looking into more of the lay literature in North Korea. And as all of you know, North Korea is on the Korean Peninsula. There was a brutal war in the 1950s that really resolved nothing. A line was drawn. Many people from South Korea ended up being stuck in the north and vice versa. And it borders China to the north. That is a satellite picture of North Korea at night. What do you notice there? It's dark, right? So, many times in North Korean history, there hasn't been fuel for lights at night. It really appears to be a country that's living like we lived in the Middle Ages. You'll see there's some light right here. That's Pyongyang. And Pyongyang is the capital, apparently world-class city. If you go on the internet now, you'll find a travel agency. You can book a 10-day visit to Pyongyang. It has opera, it has culture. Once you leave Pyongyang and go to the periphery of the country, I think things become quite dire. We know that North Korea is arguably one of the most militarized countries in the world, and we're told that 1 in 5 people work with the military in one way or another. From some of what we were hearing through our patients, we saw a fair number of North Koreans in 2012, 2013. We know that any suspicion of defiance to the state is severely punished. As a matter of fact, we're told that you cannot put pictures on your wall of your children or your parents or your cat or your dog or whatever you have in your house. You can only put pictures of the supreme leader. And there's a committee that walks around and ensures that those pictures are cleaned and dusted and the corners haven't bent. We know economic conditions are incredibly harsh. And it was really through the stories of refugees in the 90s that we were able to determine that probably close to 2 million people died of famine in the 1990s in North Korea. Those that survived often survived by taking tree bark and making a soup out of it. Horrific conditions. And any adult that we're seeing that's over 20 years old lived through those conditions in the 1990s. Most people would say that they certainly are better, but hunger and famine is not unheard of to this day. There's also a complex stratification of society. So if you're in the favor of the government, you live in Pyongyang. If for some reason your ancestry comes from South Korea, for example, or you're not in the favor of the government, you live towards the periphery of the country. You don't have the same access to the same educational institutions. You often work in some of the most difficult and dangerous jobs, such as the mines. And we know that the country is almost completely isolated. Although both the Americans and the South Koreans project radio signals into North Korea, there is no internet. It's tremendously difficult to communicate with the outside world. And there's apparently committees that will go around and check radio stations because apparently you can change the radio dial to pick up South Korean signals. But if you're caught, there's a severe price to pay for it.